In this presentation, you will likely hear some things about mammograms that you have not heard before. Some may be surprising. A few questions to keep in mind that will be discussed in the presentation are: first, should all women aged 40 to 49 get a mammogram every year? Second, can mammograms ever cause harm? And what do experts recommend about mammograms for women 40 to 49? Here's an enactment of a conversation between a doctor and a patient. This patient has just turned 40. Some doctors refer women for mammograms when they turn 40, but not all doctors agree. Listen to this conversation to learn more. Let's see, Mary, you just turned 40. Happy birthday. Would you like a referral for a mammogram?
Actually, I was hoping to talk to you about whether or not I should get a mammogram.
Oh, thanks for bringing that up. Sometimes I'm in so much of a rush, I don't stop and talk this through. Many women think they should start getting mammograms every year when they turn 40, but a group I trust, the U.S. Preventive Services Task Force, well, they recommend that women in their 40s should learn about the benefits and harms of mammography and make their own choices, not just get tested routinely. They also recommend that whenever a woman starts getting mammograms, she should get them every other year, not every year, because getting them every year causes twice the harms, but gives almost no more benefit.
Huh? That's sure not what I hear from my friends and on TV. Who is this task force? I've never heard of them.
Well, the task force is a group of volunteer medical and scientific experts. It was established by Congress in 1984 to review the evidence and make recommendations about preventive care for the health of all Americans. Members aren't allowed to have conflicts of interest, like making money from doing the medical procedures they are evaluating. Well, they look at the facts about the benefits and harms of medical tests. If the facts show a test does a lot more good than harm, they recommend that people get the test. They recommend women get pap smears to prevent cervical cancer and getting tetanus shots, and starting when you're 50, getting colon cancer screening too. But if they find the facts show a test does more harm than good, they recommend that people don't get the test. Sometimes they conclude that the balance of benefits and harms is so close that different people might make different choices based on their personal values, and then they recommend that people learn about the issue and make their own choice. That's what they concluded when they reviewed the evidence about mammograms for women in their 40s. Now, remember a few years ago I told you we only need to do your pap smear every 5 years?
I sure do. I was so glad.
Well, that was because the task force reviewed the evidence and concluded pap smears saved lives. But getting them more than every 5 years didn't increase the benefits.
So why do they say to think about mammograms when everything I hear is go get one every year? Nobody else seems to be saying that.
Well, you're right. That really makes it confusing. Other organizations don't agree with the task force, at least not yet. Advocacy groups like the American Cancer Society and the Komen Foundation recommend women aged 40 to 49 get mammograms every year. But their recommendations are based more on opinions that can be biased than the latest best science. The Cancer Society has said it will no longer make recommendations the way it used to, but hasn't updated its mammography guidelines yet.
So how am I supposed to figure this out if these groups can't agree?
Understanding the issues and making a decision is actually pretty complicated. Many times, I have my patients first discuss this with a health worker and then talk with me. But I see my next patient's canceled, so I have some extra time now. Let's start with your questions.
So why does this task force say women should think about this and not just get mammograms every year when they reach 40?
Well, you have to understand some facts about breast cancer and mammograms that most women and even some doctors don't know. First, most women with breast cancer don't die from it. Sometimes treatment cures it, and it is most common in older women, many of whom die from something else. About 12 of every 100 women will be diagnosed with breast cancer during their lifetimes. But of these 12, only 3 will die from it even if they do not get mammograms. To put it another way, only about 25% of women who get breast cancer die from it, even when they get no screening.
That's not great, but it's not as bad as I thought.
Okay, now let me ask you a question. If the risk of dying from breast cancer for a woman is about 3 in 100, How many of these women do you think would be saved if all 100 women got regular mammograms?
I don't know. I guess around 80 or 90%?
That's what many women and some doctors think. Unfortunately, mammograms are much less effective than most people think. Mammograms at best reduce breast cancer deaths by about 15%, not 80 or 90%. We like to think that earlier detection will lead to cure, but it turns out that most of the time that doesn't seem to be true for mammograms. So, mammograms reduce the number of women expected to die from breast cancer from 3 in 100 to about 2.5 women out of 100. Another way to look at this is that 1 out of 200 women getting mammograms over her lifetime is saved from dying from breast cancer. And mammograms can also lead to harms. Most women aren't aware of that. I wish we had a better test, but so far we don't.
I heard that they can pick up cancer, but that they can also pick up things that aren't cancer. They called them false positives.
That's true. A false positive is when there's something on the mammogram that doesn't look right and leads to extra tests, like ultrasounds and biopsies, but there's no cancer. Do you know what a biopsy involves?
They put a needle in your breast and get a piece of it, and then look at that for cancer, right?
Right. They numb the area first, but those injections can be uncomfortable. After the biopsy, the breast will be tender for a few days, and then the tissue is sent to a lab where another doctor, a pathologist, looks at it under a microscope. It could take a little while to schedule the biopsy and a few more days to get the results, so obviously that can be a very stressful time. When a pathologist looks at the breast tissue under the microscope, most of the time it turns out there's nothing to be concerned about, but sometimes the breast tissue shows cancer.
Yeah, I've never wanted to think about how it would feel to have an abnormal mammogram with something maybe wrong on it.
I can understand that.
But at least once they look under the microscope, then they know, right?
Well, it's even more complicated than that. Sometimes a biopsy looks like it isn't cancer, but it has a chance it could later turn into cancer. This is called ductal carcinoma in situ, or DCIS. So they can't always even definitely say. DCIS is usually treated like cancer, even though it isn't cancer. Some cancer experts think DCIS should be called something different, so that women aren't scared by being told they have something that sounds like cancer when it isn't.
Yikes. Is there anything else I ought to know?
Another problem with mammography that is still not very well understood is called overdiagnosis. Sometimes what looks like cancer on a mammogram and also under the microscope doesn't grow or spread like cancer. Because it looks like cancer, doctors treat it like cancer, so women go through the stress and the physical challenges of surgery and sometimes radiation and chemotherapy. However, they're being treated for something that never would have hurt them. This is called overtreatment.
Wow. Okay, so mammograms can have false positives which turn out not to be cancer after you get all those tests. And they can also find cancer that might not have hurt you. But at least if they don't see anything abnormal, I'm in good shape. Knowing for sure that I don't have cancer would be reassuring.
Well, it's good when it's normal, but there's still no guarantee. A mammogram is a good test, but mammograms can also miss cancer. So they sometimes give false reassurance when there actually is cancer.
This is pretty confusing.
I'm sorry, Mary. I know it is. Even experts don't all agree. Let me show you some pictures that might help you understand the numbers a little better. Let's take a group of 1,000 women who get mammograms every other year starting when they turn 40. Over the 10 years, around 330 of these women will need additional testing, such as another mammogram, an ultrasound, or a biopsy, when there is no cancer because of a false positive mammogram. This worry and extra testing is one harm for mammography. There was no benefit, and it would not have happened if the mammogram had not been done. Of these 1,000 women, about 36 will get an unnecessary biopsy, where nothing is wrong. If these women hadn't been getting mammograms, they wouldn't have gotten the biopsies. Unnecessary biopsies are another type of harm from mammograms. Of 1,000 women aged 40 to 49, screened every other year with mammograms for 10 years, about 19 women will be diagnosed with breast cancer. Without regular mammography, about 4 women aged 40 to 49 out of 1,000 would be expected to die from breast cancer. With regular mammography, about 3.5 women out of 1,000 would be expected to die from breast cancer. In other words, regular mammography for 10 years is expected to save the life of 1 woman out of every 2,000 women aged 40 to 49. And remember how I mentioned overdiagnosis and overtreatment, where cancers that would never have affected a woman get found on mammography and the woman get treated for breast cancer? Scientists are still trying to figure out how often this happens, but it looks like somewhere between 2 and 10 of the 19 women diagnosed with breast cancer will have been overdiagnosed and overtreated. Overdiagnosis and overtreatment are other harms from mammography. They involve worry, surgery, and often radiation and/or chemotherapy. Currently, no woman can know if her treatment was really overtreatment.
Thanks, I think, but I'm still struggling with how to make a decision.
Well, it's not just you. Doctors don't all agree either. Special interest groups say just start getting mammograms at 40, but I think their recommendations are biased, and they tend to support anything that sounds like it's fighting cancer, even if the evidence for their recommendation isn't good. The group I trust, the U.S. Preventive Services Task Force, says women should learn about this and make up their own minds, but that's really hard.
So the task force, which you think is less biased, says women my age should make up our own minds about whether we should start getting mammograms? But how do we decide?
Well, that's a really good question. It's hard for you to know what to do when experts don't agree. We discussed 2 main downsides. The first was false positives, which can lead to worry, more tests, and even biopsies. The second was overdiagnosis and overtreatment, where a woman is diagnosed with and treated for cancer, but if left alone, it never would have affected her. But mammograms also have benefits, though most women think they are a lot bigger than they actually are. A lot of women think that most deaths from breast cancer can be prevented by getting regular mammograms. Remember, only about 15 out of 100 women who would die from breast cancer are saved by getting regular mammograms. That's true for younger and older women.
Yeah, you said that before, but it's just so different from what you hear people say on TV. Aren't some women more likely to get breast cancer? What if I'm high risk?
The biggest risk factor for breast cancer is age. Older women are more likely to get breast cancer than younger women. This is why the task force made different recommendations for mammography for women in their 40s and older women. Since breast cancer is less common in younger women, the number of women who can benefit is smaller too. Besides older women, the other main group of women at higher risk of breast cancer are women with a high genetic risk of breast cancer.
You mean like where breast cancer runs in your family?
Yes, women who have a mother or sister who has had breast cancer, especially if she was diagnosed before age 50, and especially women with more than one close relative with breast cancer, are more likely to get breast cancer. This is because there may be a genetic mutation in the family that increases the risk of getting breast cancer. This mutation also increases the risk for cancer of the ovaries, so women with a mother or sister with breast or ovarian cancer should talk with their doctors about when to start screening. And they may want to ask their doctors whether they should have the test for this genetic mutation.
What if some of my family members had other kinds of cancer, but not breast or ovarian?
That's a great question, Mary. Cancer is not one disease. Every type of cancer is different. In general, other cancers in the family don't increase a woman's risk for breast cancer.
Well, my father had prostate cancer, but I guess that doesn't affect my risk. So how am I supposed to decide?
Well, it may help to think about what kind of person you are. Some women your age, even when they understand the risks and limitations of mammography, feel better getting mammograms anyway. They understand that there's only a small chance that the mammogram will pick up a cancer early and reduce their risk of dying from breast cancer, but they feel better getting the test. Other women your age are concerned about the downsides of mammography and choose to wait until they turn 50 before starting.
And whenever I decide to start, The task force, who you trust, says only to do them every other year, right?
Right. The task force recommends that those who do get mammograms should have them every other year. When they looked at the evidence, they felt that very few additional lives were saved by having mammograms yearly instead of every other year, but the harms are almost doubled. Most other groups recommend every year, and if you get a mammogram, most mammography facilities will send you a card every year saying you are due for a mammogram.
Wow, there's a lot to think about.
Well, you don't have to decide right now. I can give you some information to look over, and we can talk about this again on your next appointment. Or if you decide you'd like to get a mammogram sooner, you can call and we can mail you the referral slip.
Thanks. I think that taking some time to think about it is a good idea.